welcome. You're watching Health and Wellness, Myths and Facts. Hormones affect more than just our mood. There are hormones involved in almost all bodily functions, spanning from the basics such as hunger to the more complex such as reproduction and emotion. Generally, women and men have the same hormones, but their production sites, their blood concentrations and their interactions with different organs and systems are different. Hormonal disorders are more common in women also compared to men. Also, there are certain women-specific hormonal disorders. Endocrine disorders and hormonal imbalances can pose a serious health risk for the well-being of women. As we live in today's modern world, we're increasingly exposed to environmental factors that compromise hormonal balance, such as extreme stress, exposure to harmful chemicals, and westernized diets. Now, women should know which factors can trigger hormonal imbalance and how to manage that situation. Most such conditions, when identified and treated, help to correct the hormonal imbalance, thereby reducing the symptoms and health risks that are associated with hormonal imbalance. Our experts will provide medically accurate and actionable advice to help prevent the development of hormonal disorders, as well as guide our viewers with effects to long-term management strategies. Joining us today, Dr. Usha Sriram, Director of ACER in Chennai, Dr. Annie Anthony Pulikal, Consultant Endocrinologist, Medical Trust Hospital, Kochi, and Dr. Karthik Balachandran, Consultant Endocrinologist, Department of Endocrinology, Sri Ramachandra Medical Center, Chennai. Thank you all, doctors, very much for being with us on NDTV. Dr. Sriram, to you first. Hormones play a very important role in a woman's health. What causes hormonal imbalance in women, and what are the common symptoms?
Simple way of looking at hormonal imbalance is either there's too much of it or not enough of it, or things sometimes that have to be in a very cyclical fashion, that is not happening. So that's the very simple explanation. But then what causes this problem? It could be an overactive gland, it could be an underactive gland that produces the hormones, and it could be anything from stress and polycystic ovary syndrome, pregnancy, menopause. Being overweight itself can cause hormonal imbalance. And then, of course, if people have received treatments like radiation or chemotherapy or undergone surgery, then, of course, there is going to be hormonal imbalance. And during pregnancy, of course, there are going to be big changes in the hormonal levels in women.
Right. Dr. Balachandran, speaking of hormonal imbalance, it not only impacts health but also negatively impacts the quality of life. What are the kind of health conditions that are caused by hormonal imbalance?
Now, hormonal imbalance is a colloquial name for a variety of hormonal abnormalities, which can be, again, too much hormone or too little hormone. In order to understand this, we should know that hormones are basically body signals that control distant organs and tissues. So a hormone can be produced at one site and exert its action at a different site. Because of this, a hormone produced in the neck can work at ovary or some other place, and therefore the signs and symptoms of hormonal disorders are very varied. So these could include excess hair growth or no hair growth at all, excess growth or short stature, early periods or delayed periods, early menarche, or that is early puberty or late puberty, obesity, leanness. So wherever there is a difference from normal, either to the plus side or to the minus side, we can think that there could be a hormonal imbalance. Now, the term hormonal imbalance itself doesn't help in proceeding further, because we need to know which hormone is abnormal and why it is abnormal and where it is coming from. And that is the role of an endocrinologist. We basically evaluate a patient to see what is going wrong with the patient suspected of hormonal imbalance. And some of the common conditions that are related to hormones include the commonest endocrine disorder is diabetes itself, then thyroid disorders, overactive or underactive thyroid, polycystic ovarian syndrome. Apart from these common ones, there are also several uncommon ones from head to toe. It can be a pituitary problem, a parathyroid problem, adrenal gland problem, or a problem even in the bone. Bones are also hormonally active. So in order to identify what problem the patient has, it is useful for us to basically delve deeper and find out where the problem is and what the problem is. And that requires a battery of tests which are best done based on the clinical profile.
Right. Dr. Pulikal, if I can come to you, is it true that women are at least 5 times more likely than men to have thyroid disorders?
Yeah, it's really true that women are at a higher risk for thyroid disease than men. Be it hyperthyroidism, where you have an overfunctioning gland, or hypothyroidism, where you have an underfunctioning gland. Most of them are autoimmune in nature. And if you look at autoimmunity, it's more common in females. Autoimmunity is nothing but when your immune system acts against your own body. And females are at a higher risk of autoimmune disorders due to multiple causes. Maybe because of their hormones. The X chromosome itself gives them a higher risk of autoimmunity. And even pregnancy and the hormonal changes associated with pregnancy make them at a higher risk for autoimmune disease. Let alone autoimmune disease, even if you look at thyroid nodules, which is another common condition which you see in thyroid, even thyroid nodules are seen increasingly in women than men. So overall, thyroid disease are seen more commonly in women than men.
Right. Dr. Sriram, it's also been observed that women are more prone than men towards certain psychiatric disorders as well. Is this heightened risk to women essentially due to these, hormonal differences?
So even at baseline, women are more likely to be diagnosed with depression and anxiety, and there are many reasons for that. And all the hormones, whether it's estrogen or progesterone and even testosterone, has an effect on mood and mental health. And as we know, prior to menstrual cycles, women can have like a premenstrual syndrome. Around menopause, very well known that women can have mood changes. And there are many other social factors and other things that can actually heighten this or worsen this. And any hormonal dysregulation, as we have just heard, thyroid problems are more common in women. Polycystic ovary syndrome is more associated with mental health issues, and like irritability, depression, anxiety, all these are worsened by hormonal imbalance.
All right, very interesting. Dr. Balachandran, what kind of hormonal imbalance causes acne, and how does a person know if the acne is in fact hormonal, and what is the treatment?
Okay, so acne is again a technical term for what we commonly call as pimples. Acne could be caused by a variety of hormone disorders. The real question is the hormone playing the vital role or the primary role in acne? So normally we might see that acne occurs in adolescent people. So if acne occurs in unusual age group, before puberty or in the 30s or around menopause, so unusual age group or unusual severity or unusual response to treatment, if it's not responding to usual treatment, then we can think that it's not just common garden acne, but something else is going on. Also, if there is signs of other hormonal excess, like excess hair growth or some other clinical features that suggest another hormonal disorder, then again it's a clue that the acne is primarily driven by a hormonal abnormality. In which case, again, as I said before, we wonder what hormone is causing this, and subsequent tests will reveal which hormone is the problem. So we then proceed to treat that by reducing the formation of the culprit hormone or at least block its action. Now, at this point, most acne will have a basic issue related to lifestyle, that is sleep, stress, exercise, and food intake. If we fix all four of these things, there's going to be benefit even if the acne is primarily driven by hormones. So that is the thing that we need to understand. Apart from that, severe acne can also be treated by anti-male hormone treatments, that is anti-testosterone kind of treatments. And women who take this should understand that these treatments, hormonal treatments for acne, take time to work, around 3 months at least, and they can cross the placenta if they get pregnant. So they can also affect the growth or form, especially genital growth of a male baby if they conceive. So these hormonal treatments for acne should not be taken without medical supervision, but lifestyle changes should be done for every acne, whether it is hormonal or not.
Right. Dr. Pulakal, hormonal imbalance in females can also cause hirsutism. Which hormone imbalance actually causes it, and what are some of the treatment options that are available?
So, hirsutism in simple language is excess of hair unwanted hair in females. So, there are multiple causes of hirsutism. Hirsutism is mainly caused by increased male hormones in females. The most commonly seen male hormone, and which is the most active one, is testosterone. You can have other hormones which are actually precursors of testosterone being circulated in the body, which later on gets converted to testosterone and cause increased hair growth in females. And if you want to treat hirsutism treatment depends on what causes hirsutism. If you look at the causes, PCOD is one of the most common cause of hirsutism. PCOD, and if you want to treat PCOD, like Dr. Balchandran had earlier told, diet and lifestyle modifications will really help. Reducing weight, regular physical activity will help in reducing hirsutism in PCOS. Other medications like anti-androgens do help. And if it is, there are other causes of hirsutism, like ovary, like a tumor, which is actually secreting testosterone or other androgens. So in that case, you will actually have to remove the tumor in order to relieve the symptoms. You can have idiopathic hirsutism where you might not have excess of androgens. So in that case, these medications might not work, and they might have to go for other therapy like laser therapy, which will be beneficial for them. You can have genetic conditions where they can have enzyme deficiency, which leads to increased testosterone production, which causes hirsutism. So in that case, they will have to find out where which enzyme is deficient, and we have to treat accordingly. You can have medications which can cause hirsutism. So if they are on such medications, we might have to taper them and stop those medications. So treatment of hirsutism is not a single thing. It depends upon the cause, and we have to find the root cause and treat that.
Right. Dr. Sriram, what is known by premature ovarian failure, and what are some of the complications that can be caused by this premature ovarian failure?
This is such an important question. I may actually take a little bit more time to go through this because this has very long-term implications for women. So first thing is premature ovarian. We used to call it failure, but now we call it insufficiency. Is when women stop having menstrual cycles before the age of 40. And if they have it before the age of 45, we call it early, but premature is clearly anything before 40. So normally women are supposed to go through their menopause somewhere around age 50. For Indian women, it's supposed to be something closer to 47. So when you have stoppage of the menstrual cycles before the age of 40, you can see that they are not going to have the benefit of having estrogen in their body for 7 to 10 years or longer, depending upon when it stopped. So what causes this is the first question. Autoimmune disorders are more common in women. Thyroid is one of them. So this is another autoimmune disorder, and a very most common cause of premature ovarian insufficiency is actually autoimmune disorders. But it can also be many other conditions, including genetics. So what can be the symptoms? The symptoms are usually very, the same typical symptoms of menopause, which is hot flushes and night sweats and feeling fatigued and sleep disturbance, mood swings. These are like acute symptoms. And some people have dizziness and other things. The longer symptoms are what I'm going to talk about now, longer health issues rather, which is as women post-menopausally, as their estrogen levels have declined, we know that they can have bone loss, and which is why as people get older, they are at greater risk for fractures. So you can imagine if a woman has had her stoppage of menstrual cycles and premature ovarian insufficiency in her 30s or sometime even in their 20s, that many years of lack of estrogen is going to increase their risk of osteoporosis. And estrogens are also needed for women for their heart health. They have a 10-year advantage normally over men when it comes to heart health, and that's because of estrogen. And now if their estrogens have packed up earlier, they can have risk of heart disease. So it's really important to keep these in mind and not think of estrogen only as something for reproduction. And how do we treat this? We treat it with hormones primarily,
Right.
and of course talking to women about the importance of bone health and heart health.
All right. I think very important differences, Doctor, that you've explained there for the benefit of our viewers. We're going to slip into a very short break, but our conversation will continue on the other side. Stay with us. Welcome back. You're watching Health and Wellness Myths and Facts. Dr. Balachandran, if I can come back to you at the moment, some women, during midlife experience a thinning of the scalp hair. Is this caused due to hormonal imbalance problems as well?
Yeah, it could be caused due to hormonal imbalance. To be honest, thinning of hair and receding hairline is a problem for men as well in midlife and for women. And in both cases, the male hormone testosterone could be a culprit or its derivative dihydrotestosterone. So when we see a woman with thinning of hair, it could also be associated with hair fall. So we need to know what is the pattern of hair loss or thinning of hair. If the thinning of hair does not affect the frontal line, then that is called a female pattern hair loss, where it is a little diffused throughout the head. But if they're losing hair or thinning only on the sides, then that is male pattern or more of male hormone dependent hair loss. Now, when such a thing happens, then we check for the male hormones. Now, these male hormones also tend to have effects on other parts of the body. The woman might develop hirsutism, as Dr. Annie mentioned previously, excess hair growth, or that could also be, a manly structure, muscle growth, or change in voice, or acne. All sorts of other problems can also creep up. Apart from hormonal problems, which actually occupy only a small portion of patients who have thinning or loss of hair in midlife, there are a variety of other problems such as nutrition. Our country has a lot of anemia problem. Many women tend to have iron deficiency anemia, which again could contribute to this issue. Apart from that, stress, any kind of stress can lead to temporary hair loss or thinning of hair, and usually it comes back after the stressful period or event is over. And even recent infections such as COVID can also lead to excessive hair loss, which again could prolong for a very long time, as in the long COVID or the post-COVID syndrome. So we have a variety of causes for thinning of hair or loss of hair. Depending on the amount of hair loss, the pattern of hair loss, and the associated features, we decide whether it is associated with the hormonal problem. If it is a hormonal problem, there could be broadly three hormones which we normally think. One is the male hormone testosterone, the other is the stress hormone cortisol, and thirdly, it could also be due to thyroid. At this point, it is important to emphasize that thyroid is getting blamed for all kinds of things. So not all hair loss is thyroid problem. We need to check the thyroid tests to identify whether it is a thyroid problem. So once we identify the problems, then we can appropriately treat the patients. At this point, there is a sort of point of caution for our audience. Many over-the-counter medications which help in hair growth or prevent hair fall contain a vitamin called biotin. this biotin can interfere with hormone tests. So if you're going to a doctor to do a hormone test to see if your problem is indeed caused by a hormonal condition, then it is important to disclose whether you are taking some natural supplements or vitamins that might contain biotin. Otherwise, the test results can be quite chaotic, and potentially it can even result in misdiagnosis. So it could be due to hormonal problem, but to evaluate that, we need further data. Yeah.
Right. Dr. Pulakar, please share some tips with women of all ages, to prevent hormonal imbalance.
So the tips for prevention of healthy hormonal imbalance is mainly to stay healthy. To stay healthy, the first important thing is that you have to maintain a proper weight for your height, which is the most important thing.
And have regular exercise schedules, at least around a moderate physical activity around 5 days a week for at least half an hour, which would help you. Avoid stress and get into activities which will help you to reduce your stress, because stress is a major contributor to hormonal imbalances. And if you are having other metabolic diseases like diabetes, hypertension, thyroid disease, all these should be adequately treated and well in control, and have a good sleep, at least 8 to 10 hours of sleep, which is also necessary to maintain a hormone balance. And whenever you are in doubt, whenever you're having irregular cycles or any of the symptoms of hormonal imbalance, which Dr. Balkrishnan has told, you have to go and meet a doctor as early as possible so that you can treat them at the earliest, diagnose early and treat early, so that you stay healthy.
Right. Dr. Sriram, how does vitamin D affect female hormones?
So what we know is that vitamin D is important for our bones. But what is less well known is it has a lot of extra skeletal benefits, and also there are effects of, there's a relationship between vitamin D and other hormones as well. So, typically vitamin D is something that we get from sunlight and very few, some food sources, nothing in the vegetarian foods. So even though we are a country with plenty of sunshine, there is a tremendous amount of vitamin D deficiency. And vitamin D regulates a lot of the hormones, has connections with the immune system and infections, which is why during COVID-19, vitamin D was consumed by most people. And also it has very, very important connection with metabolic health of people, and especially things like glucose control and insulin and other hormones. So there it is very important. And what we have not really known that much is that vitamin D also has a connection with estrogen levels. And a low vitamin D may also lead to symptoms that can happen with estrogen deficiency, which may be mood swings and mental health issues and hot flashes and depression. So having optimum vitamin D level is not just for good bone health, which we have always known, but it is also very, very important for overall good health. And there's a connection, like I said, between good immune function, a good metabolic function. There's a lot of observational data connecting vitamin D deficiency and cancers. So we need to promote good vitamin D. So if, especially for women, because they may be indoors, they may be concerned about skin color and not going out in the sunlight. Many of them may not be having enough fish or other food intake that increases vitamin D levels. They may not be going out for other reasons to get the vitamin D. And as is, they are more prone to, like I said, osteoporosis and more prone to heart disease. And if their vitamin D is low, it could aggravate these conditions. So optimizing vitamin D with sunlight, nutrition, and supplementation wherever necessary will make sure that they have a good vitamin D level throughout their life.
All right. Thanks so much for that explanation, and thank you, doctors, very much for joining us.